Hi, and welcome to this edition of EasterSeals. Today I am here with Eric Sobolski and Rachel Corbett from our Medical Rehabilitation Center. Before we start, I'd like to thank Sky 13 for giving us this opportunity to tell everybody in the area about EasterSeals and what we do. And thank you to Thomaston Savings Bank for providing a grant to fund these videos. So welcome, Rachel. Welcome, Eric.
Thank you.
Nice to meet you both. What do you do? Eric, why don't we talk to you first? What is your role at EasterSeals?
Well, my role at EasterSeals is the Director of Rehabilitative Service Programs, which oversees 3 different programs in the area, one of which is the Driver Assessment Program. I also oversee the Medical Rehab Facility in Meriden, as well as a contract with Wallingford Public Schools for OT services.
Great. And what brought you to EasterSeals? How did you get here?
Well, I've been an occupational therapist for a while, and I've worked in a number of different areas, nursing homes, acute care, home care, outpatient. I really enjoy outpatient, and a position opened up as a leadership position with EasterSeals, and I took the opportunity to move along. I really like the organizational thought of EasterSeals on helping all and helping everyone with disabilities, and thought I could make a good change.
Oh, that sounds good to me. Rachel, how about you? Tell us a little bit about yourself.
I went to Sacred Heart University in Fairfield, and I got my Master of Science in Occupational Therapy. And I've been an OT now for almost 14 years. And I have worked in acute care, in short-term rehab, in outpatient rehab, and now I'm with EasterSeals.
In the Rehabilitation Center.
Correct,
Great.
yes.
That's great. That's great. So tell us a little bit, maybe Eric and Rachel, you can both kind of answer this. What goes on at the Rehabilitation Center? Like who works there, and what is your staff comprised of?
Okay, well, we have physical therapists, we have occupational therapists, and we have speech language pathologists. We service the whole entire community and whatever needs they need. We treat a number of variety of disabilities, whether it's neurological in nature, orthopedic, or even developmental disabilities as well. We're open from 7:30 to 7 o'clock. Monday through Thursdays, and 7:30 to 4:30 on Fridays. So this is a big thing. We expanded our hours, and we're seeing a bigger need in the evenings for working folks as well. Yeah. So we serve all. We serve all.
So there's no age limit. You can be a toddler, or you can be a older adult, right, to come to your center?
Absolutely.
Great. That's good to hear. And so when you're treating your patients, what kind of approach do you take to serve their need? You know, how do you evaluate who they are, and what kind of treatment plan you would give to them?
Well, what we do is we work on creating solutions for changing lives. That's the main mantra. And what we do is, what I try to explain to my therapists, as well as everyone that has maybe been a student of mine, is that in order to really understand or fix a solution, you need to know the problem. And I think that's half the battle of being a therapist, is actually having individuals understand whether it's an injury or whether it's a physical disability of which they have to live with. Understanding their problems is half the battle of actually getting a solution.
Right.
So what are maybe some examples of how you have treated a specific injury or issue or disorder using occupational or physical therapy? I'll let you both answer.
Well, I'll start off with the basic orthopedic one. I'm an occupational therapist. I specialize mostly in orthopedics. And there's many a times where I'll have working folks coming in who do a lot of manual labor, and they end up having a repetitive strain disorder.
What is a repetitive strain disorder?
Repetitive strain disorder occurs when you're doing something on a repetitive nature. Whether you're,
for example, if you have a job where you are maybe working at a grocery store and you're having to restock shelves, you're doing a lot of repetitive motion overhead and at varying amounts of weight. But doing that repetitively over years can do a lot of damage to your shoulders.
Like maybe sitting at a desk hunched over on a keyboard.
That could be it too. That's a totally different one.
Some of it is postural also, absolutely. But it's educating the patient and talking to them about, okay, let's break this down as to why you have this problem. Because a lot of times people will come in and be like, oh, you know what, I think I did this at the gym. And then you dive into it a little deeper and you're like, oh, well, what do you do for work? And how long have you been working there? And, you know, as you're talking to them, you start to understand a little more. And like, oh, and you know, we have a new baby in the house. Oh, okay, so you're lifting, you know, carriages and you're lifting the baby in the carrier in and out of the car. And you have a car that's, you know, a little bit bigger, so you have to lift up. So, you know, once you break it down, you can figure out, you know, where somebody is having the issue. So then you have to teach them, you know, one, you have to work on, you know, the actual injury, what the issue is, whether that be, you know, a rotator cuff issue or if it's, you know, a tendinitis or, you know, bursitis or something like that. But, you know, you kind of break it down to modifying activity also. So you have to teach people how to change their lives essentially to prevent this from reoccurring.
So I from my own experience, I've gone to rehab. I you know, am a little athletic and do tend to get some injuries. And I don't know that I've ever been somewhere where my physical therapist or my occupational therapist has talked to me about my problem and where it stems from. So I do think that that's a really different approach that you are doing at the rehabilitation center at EasterSeals. I think that that's wonderful. And you do that with every patient?
That's with everybody. Anyone who walks in the door, you know, from your orthopedic to your neurological to, we'll get into it later, my vision patients, even my driver patients.
Yep, you have to know the problem.
Yeah,
that's
you have to understand what the problem is in order to help somebody. Because it's just going to happen again, especially with a lot of the repetitive strain and chronic pain, you know, things like that.
So, and I also think it's important to tell everybody that you're not physicians. You are occupational therapists and physical therapists.
We do not diagnose. We do testing that can, you know, lead us to think that maybe this could be the problem. And within our documentation and our notes, we are writing, you know, suspect tendinitis, patient had positive, you know, whatever it may be. And then that note gets sent off to the physician, and that may help the physician to narrow down more, you know, what that person's issue is, because you don't know what the patient's telling the doctor either. You know, so we are spending, you know, a little more time on that specific injury, you know, and can then give more information to the physician, and that may lead to a referral to an orthopedic or maybe a cortisone shot or whatever that person may need.
I think that's fantastic. That's so good to
hear.
Those
are successful stories. Bringing an injury and getting it to the proper medical area would be key.
And that's what EasterSeals does as a whole is a very community organization. It's a team approach, exactly. And I think that's wonderful.
Well,
I think
we're occupational therapists, but we work very closely with the physical therapist and the speech therapist as well. So, you know, if I have a patient that, you know, I'm seeing for vision and I notice, you know, they got maybe it's a little balance deficit going on there and there's some muscle weakness and, you know, they're telling me that they're falling all the time, then I'm going to refer that patient to physical therapy. And, you know, I might even grab a physical therapist and say, hey, can you take a look at this person? You know, I'm wondering if they have a drop foot, you know, maybe it'd be a good idea if they got a referral to come see you. So, you know, and same thing, maybe it's a speech issue. So maybe I'll see somebody where I'm noticing that, you know, they're not necessarily comprehending everything I'm saying, or they can't get their words out, or they mention a swallowing difficulty. Then I'll say, oh, well, maybe, you know, you should go to see speech therapy.
Well, it sounds like there is no injury that cannot be treated here. So that's fantastic. So, you know, you had mentioned a little earlier, we talked about the driver program, which is our driver assessment program that is one of two in the state of Connecticut, and it is located in Meriden on State Street. Why don't we talk a little bit more about the driver program and driver assessment program and what it is and who can really benefit? Like, where do you start? What is it? Who comes here?
Yes. So the driver program is an assessment that looks at the whole person.
Right.
And this is for all ages. This is not just strictly for a geriatric population. I see clients that are adolescents all the way up to people that are, in their 90s, 100 years old.
Still driving.
Yes, still driving.
Amazing.
Yes, absolutely.
Amazing.
So people might be referred, maybe they got into a car accident and their doctor's questioning if, they're able to drive. Or maybe they had a medical condition where now they are, have a spinal cord injury and they're a paraplegic and they can no longer drive with their feet. Maybe it's a parent that is wondering, my child is on the spectrum and they also have ADHD. Like, is it a good idea for them to even go for their permit?
Right.
So it's it's an interesting population because it's always something different. So, and then there's also where, doctor says, maybe might diagnose somebody with early onset of dementia or early onset of Alzheimer's, something like that. And maybe they just want a baseline for this person. Like, they're not like, oh, you shouldn't be driving, but hey, you know what? You're presenting with some cognitive deficits that maybe we should, take a look at as far as driving is concerned.
So does a doctor come to you directly, or can the family come to you with, say there's a child that they're not sure that, or an adult that they're not sure that they should be driving? What's the process?
Right. So we do get a lot of phone calls. So a lot of people will call and just ask questions. So we do need a referral from the doctor for these people to be seen, because we're also getting not just the referral, but the doctor is giving us just a little information about the patient. So I don't need a Bible of medical history, just a little bit of a background.
Yeah.
So, what their past medical is, what their current issue is, really, their up-to-date medications and things like that, because, we need to know those things and the medications that that person is taking, if they could be affecting their ability to drive as well.
Okay.
So we need, just a little bit of information on that person. And the referral you can actually download, right?
Right.
From our website.
Right.
So, okay, good. That's perfect. It's right on the driver assessment page, I
Right.
believe.
Yeah.
So, okay, so say I have vertigo. Say that's my issue, and my doctor doesn't think that I should be driving. I don't necessarily want to believe that, but he refers me to, and this is just an example, I get referred to the driver assessment program. You've taken down my history, we've talked a little bit, and you feel that it is my turn to get an evaluation, if I can drive or not. Now what happens? What does this evaluation consist of? And is it safe? How does it go?
So it's a comprehensive evaluation to look at a person's safety operating a motor vehicle.
Okay.
So it's broken down into two sections. So you have your clinical piece, which is 2 hours, and then you have your on-the-road piece, which we also block 2 hours for. So the clinical piece consists of looking at your vision, looking at your cognition, how you're problem solving, how you're thinking, if you can follow directions, are you oriented, things like that. And then I also look at a person's range of motion, strength, balance, coordination, and I just kind of use my clinical observations to observe them as they're walking around.
So it's just a walk around the
Well, no,
office.
it's not just a walk around. So I go grab the patient, I bring them in, and then I usually start with, just asking them why they're here.
Yep.
So I know why they're there. However, I want to know if they understand why they're there.
Yeah.
And I like to have family present also, because a lot of times the family will give feedback and, might fill in the blanks of some things that might be missing.
Yep.
Like if someone has gotten into an accident and
Yep.
they might not want to give me the details of that accident.
Right.
It's nice to have the family there to be able to give me, the full picture.
Right.
So it's always nice to have family. So we kind of just sit there and talk about, what's going on, why you're here. Then I go into, telling them about exactly what we're going to do today so that they understand. And then I usually will start with a quick vision scan. So I'm looking at, somebody's vision as far as, can they track, can they scan, can they move their eyes from one spot to another spot quickly and smoothly? Do they have any blind spots?
Yeah.
So I'll do just kind of a quick scan of all of that. And then I'll look at contrast sensitivity. So
What is contrast sensitivity?
there's high contrast where you have like black on white, and then there's
okay.
low contrast where you have like gray on white.
Okay.
So if you think about it, when you're driving, if it's a gray day outside and there's a gray car in front of you, and you cannot see low contrast,
Right.
you may not see the vehicle in front of you,
Right.
and you might crash into them.
We don't want that
if
to
you're
happen.
not paying attention. So, contrast is actually really important to look at. So I actually have a low contrast chart that I use, and I'll hand it to the patient. I'll say, can you read me those numbers? So I just get, an idea of how well they see contrast. From there, I usually move on to a cognitive assessment, which consists of looking at, a person's visual spatial skills, their memory, delayed recall, attention, language, and overall direction following, essentially. So that screen gives me kind of a base score, and then that score can kind of lead me in the direction of where this person is lying cognitively.
Okay.
Do they have maybe mild impairment, moderate impairment, maybe they have some severe impairment going on. Not my end all be all for my decision making,
Right.
but it's just a piece of, of the puzzle, essentially. From there, I usually move on to some more cognitive testing, where I'll hand them a piece of paper that it's called trail making. So they have to sequence 1A, 2B, 3C, and so on. It has to go in order, and they need to be able to, connect everything, remember where they are, shift their attention, scan to find what it is they're looking for.
I don't know if I
sequence.
would pass this.
It's not an easy test, and a lot of people will sit there and say to me, "Well, I don't understand why I have to do this. This has nothing to do with driving." I'm like, "No, actually, it does."
Right, right.
And then I'll give them an example. I'll be like, "Okay, so you're in the car and you're driving, and all of a sudden, some kid runs out in front of the car. Are you able to attend to that? Can
Right.
you, problem solve quick enough in your head to then hit the brake?
Right.
So, it actually is really important. And are you scanning your environment? So are you driving with tunnel vision, or are you actually looking everywhere? Because your mirrors in your car are there for a reason. They're not just there to be there.
I feel like there's a lot more people that don't get the test than that should get the test.
This is very true. Very true. So, then after I do that, then I usually move on to a little test that's all about the rules of the road.
Right.
So it's looking at just asking basic questions about the rules of the road and right of way. So I have an idea of kind of what people know and what they understand, and then I can kind of visualize, in the car with them, questions that I should be asking, and
So how long does that first part, all of the contrast, and how long does that take, really?
It's about 2 hours.
All
You're
right.
there for at least an hour and a half, at the most 2 hours.
Wow.
Because then from there we have a stereo optical vision tester that we use, that the DMV actually uses to look at visual acuity, to look at peripheral vision, depth perception, things like that. So those are all clearly really important with
Very
driving.
important,
It's looking
yes.
at your ability to, your binocularity, being able to use the two eyes together to be able to view the world, essentially. So we use that because legally in the state of Connecticut, you have to have 20/40 for your distance acuity to be able to drive.
Wow.
And you have to have 140 degrees of peripheral vision in your horizontal meridian also. So I legally cannot take someone out on the road if they don't meet those requirements.
Oh, that's good to know.
Right.
Right.
So in that case, sometimes what happens with the driver assessment is we might find some things that could be a problem. Like, I'll say, oh, well, you know what, your distance acuity is not within state guidelines. You need to go back to the eye doctor. Maybe you need a new prescription.
Right.
Or I do some testing with somebody where, there's another test I do. It's called the Bell's test, where I'm looking at scanning. So it's interesting to watch how people scan, because if you've had a stroke that's affected your vision, or maybe you've had a traumatic brain injury that affected your vision, or you have a low vision diagnosis that affects your vision, those people typically don't scan from left to right. They're kind of all over the place.
Wow.
So they might start in the middle, and they might not go all the way over to the left, or they might scan from right to left. So it's interesting to watch them. So as I'm watching them do this, I'm like, oh, now I wonder how you're scanning when you're in your vehicle. Are you actually, getting everything?
Right.
Do you have an inattention to one side? So that might create a referral to occupational therapy or to physical therapy as well, to work on balance too.
Which is important, because this is where Eric comes in, and this is how you
and
guys
we're
work
all
together.
in the same building,
Right,
so
absolutely.
I can easily pull somebody else in. So
That's
then
great.
once I get through that, we also have a machine called a useful field of view, which is predictive of crashes. So it actually gives you a printout of the person's risk for crashing, and and it's looking at visual attention, so your ability to attend to something directly in front of you, so in your central vision, and then also in your peripheral vision at the same time.
Wow.
So it's like a touchscreen test that you're literally like tapping the screen and following the directions, but it's looking at so many different things. I mean, it's looking at your attention, it's looking at your visual memory, it's looking at, can you attend to central and peripheral together, because some people cannot. So it's looking at your divided attention, selective attention, and then again, the cognitive piece of things. Can someone even follow directions to take this test?
So it sounds like it's quite involved the
is.
first
Very
2 hours.
comprehensive.
Very
It is.
communicated.
It could be exhausting for some
It's
people.
very,
I
it's very
imagine.
intense.
Yeah,
So
there's a lot of things it seems that you're measuring,
right.
which is probably good. I mean, you have to in
Right.
order to make sure that someone can safely navigate around a road.
Exactly.
So once they do get through this brutal,
And
but
even
necessary.
after that, I'm looking at someone's range of motion.
Right.
So I go from the neck all the way down. I look at their range of motion, their strength.
Yeah.
I look at coordination. I look at their sensation. Do they feel light touch? Do they feel
Right.
deep pressure? And then I'll have them close their eyes, and I want to see if they know where their body is in space.
And this is where your training as an occupational therapist comes into
Exactly.
play. Okay.
Exactly.
That makes
Yep.
that makes perfect sense to
Yep.
me.
And then from there, we'll move on to the driving simulator.
And would you do this in the same day, or is
Yeah.
it usually so someone can actually be in the office for
Oh, they're in the
3 to
office
4
with me
hours?
for definitely 2 hours for the clinical. Some people I will do part 1 and part 2 in the same day, but that we rarely do that because it is a lot.
Yeah.
Usually after the 2 hours of the clinical, people are like,
they're done.
I'm
We're
done.
tired today.
I'm ready to go
It's a
eat
lot. It
something.
really is a
Right,
lot.
right.
So it's a lot. So, I really don't love to get in the car with somebody right after I finish all of that
Yeah.
because, they're kind of, that's a
Toast.
lot.
Yeah,
they're
it is-
kind of
it's a
toast.
lot. It's
Unless
pretty
it's
intense.
someone that's just kind of breezing through and this is easy for them and,
Right.
then that's fine. But it varies. But then before I will get in a vehicle with someone, I will also do crash simulation and I will do checking their braking reactions also.
Right.
So we have a simulator in the office that I'm able to sit people in and get those numbers and, observe how they would react to certain situations.
Which is perfect. And then, so that's the final piece in the first 2 hours
That's
of
the
the
clinical.
assessment.
So
All
that's
right.
the clinical piece of things.
So then we take a break, right?
Yep.
Maybe you come
Or
back
you come
the
back
next
another day.
Right.
Right.
And you're going to take a road test, basically.
Correct. Yes.
Okay. So if do you have, so say someone is in a wheelchair, right? And how do you know that, how do you have controls in your vehicles?
Yep.
Oh, this is great. Everybody's nodding their head. I'm asking the right questions. So do you have controls in the vehicle and feet? And tell me a little bit about how that road test works.
So if I'm just going to give you an example.
Yeah.
So we do a lot with the Bureau of Rehab Services. So a lot of their cases have to do with adaptive driving. So we have 3 vehicles at EasterSeals. We have a van that has a wheelchair ramp in it that is a power ramp that folds out, and we're able to then manually lock down people that are in a wheelchair into our vehicle. And then there are hand controls also in the van, and we have steering knobs, and our van also has the ability, because depending on, within my clinical assessment, I'm figuring out their upper extremity strength, range of motion, like coordination, what they have available that they can use for driving with hand controls, because you have to think about your primary controls and your secondary controls. So, it's a lot to really look at, which is why we get the person into the vehicle.
Yeah.
So some people want to transfer from their wheelchair into the driver's seat. So we have a driver's seat that pivots. It's a swivel seat, and the person can then sit in the driver's seat and drive from the driver's seat with the hand controls that are already installed. Or we can take the driver's seat out and then lock the person into the driver's seat position in the van. So a lot of people that are driving from power wheelchairs will typically be driving from the wheelchair.
That's wonderful.
Yeah, so it's interesting.
So when I know when I was learning how to drive many years ago, my mother had the imaginary brake in the passenger
Yes.
side.
We
So
do it. They're
Every
dual
vehicle.
control vehicles,
Oh,
so I
good. So
have
you
my
have your
own
own.
brakes. So it's kind of like a driver's ed car.
Right.
So I always warn people. I'm like, okay, here's what's going to happen. I'm going to tap this brake on you so you understand what that feels like.
Right.
And I might grab the steering wheel intermittently.
Okay.
It'll depend on
fair enough.
how you're
Fair enough.
I'm just going to be honest with you because
right.
I don't want you to be surprised if you see my arm come across your body.
Right.
Right.
You know, especially if you're doing adaptive driving.
So are you on the road with someone for 2 hours, or is it mostly like getting everybody situated
It
to get on
depends
the
on
road?
the situation. So if I'm doing an evaluation for adaptive driving where I'm going to be making recommendations for vehicle modifications, then that's going to probably mostly be in a parking lot.
Okay.
So I will educate the person on the hand controls. So if you're driving with hand controls, they're typically mounted to the left of the steering column. You're pushing to brake and you're pulling to accelerate. So there's different types of hand controls, and you know, I figure that out when I'm with that person, what I think would work for them best.
And now once this, so basically the whole second part is just on the road testing or in the parking lot testing.
Right.
When you're done with this testing, will someone know right away if they are able to get on the road, and how do you determine that? Like, how does it go, and are you going to deliver the bad news, or how does that all work?
Yes. So after my clinical assessment, I sit people down and I give them a summary of our visit together. And I say, okay, you have demonstrated the skills or you have not demonstrated the skills. If I'm saying no, then I'm giving you my list of reasons why.
Okay.
And then I may also be giving you recommendations for physical therapy or OT, occupational therapy or speech therapy, or maybe you have to go see the eye doctor, things like that. If it is someone who has passed and they're moving on to part 2, at the end of part 2, I do the same thing. I don't say anything in the car. I wait until we come back to the clinic. We sit down together. I pull out my, recommendation sheet and I say, okay, listen, I think you did a great job and this is why, or I have concerns and this is what I noticed on our drive. So, I'm being very upfront and honest with them and telling them exactly what I saw. And I tell them all the time, like, you don't have to agree with me. You absolutely don't have to agree with me. I'm just giving you my professional opinion of what I saw here today. And I understand this is just a snapshot of you today. However, this is what I saw and this is what I am going to report.
And this is the changing lives part of the creating solution, changing lives mantra at the rehabilitation center.
And unfortunately, if it is somebody who we're recommending, like, it's not safe for them to drive anymore, then we'll talk about, other solutions, you know what, there's a lot of, different ways to get around nowadays. There's Uber, there's a lot of senior transportation, a lot of senior centers that will provide transportation for medical visits and things like that. So we talk about what town they live in and what possible resources there could be. There's usually family there, and the family have already usually been problem solving, different modes of transportation for their loved one. So it's not easy, but we talk about safety and of people and people on the road.
I think the most important part is getting the physician involved also with this. They play a major role in the care of the patient, and having this insightful, comprehensive evaluation helps them make a better decision of whether a patient should or should not be driving as well.
Yeah, I think it's important. It's important for everybody to know that EasterSeals is a resource. If you watched Lorraine on the last video, she does talk about EasterSeals as a resource, and it's important that Eric and Rachel said that EasterSeals is not going to just not let you drive. It is your decision, and but we do provide other avenues for you if it is something that EasterSeals Rehabilitation Center does not recommend. So thank you, Eric, and thank you, Rachel, for coming in today. We do hope that you found this informative. And if you have any questions, feel free to visit us on our website. It is www.easterseals.com/waterburyct. If you or someone you know is interested in getting a driver evaluation, you can go to your physician. Our referral form is on our website under Driver Assessment Program. Thank you all for watching us today, and if you have any questions, please visit our Facebook, our Instagram, or our website and let us know.